We're here today with Temple Grandin, who in addition to being voted as one of the top 100 most influential people by the Times Magazine, is also an absolute hero and a world-renowned professional in the field of autism. You've achieved a remarkable amount of things in your life. And people want to know, was there ever a turning point in your life where you realized that you had to consciously take steps to improve or do better?
Well, one of the big turning points was my science teacher got me interested in doing science, and I finally decided that I was going to knuckle down and start studying. But also, there was a lot of things that was just gradual. Starting my business, it was one small project at a time. I started writing one small article at a time for the Farmer Ranchman magazine. I started doing freelance, one design project at a time. Building up my business was very gradual. There are a few turning points, but there's also an awful lot of just gradually improving.
I know that deep pressure and your squeeze machine helped you greatly when you were growing up. But in today's world, with all the technology and advances, what do you think would most help, sensory-wise, a child focus and concentrate in a classroom?
Children have different sensory problems. Some kids are visually sensitive, and 60-cycle fluorescent lights make the room look like a fluttering strobe light discotheque. I do not have that problem. Sensory problems are very variable. One kind of kid, you got to get him away from 60-cycle fluorescent lights. I was fine with fluorescent lights. Another kid may have sound sensitivity, and loud noises may hurt his ears. Another person may have problems with the scratchy clothes against their skin. Another individual, strong smells. It can be very, very variable. The sensory problems are real, and they can be very debilitating. There are some people that can't tolerate just being in a normal restaurant because they'll be in sensory overload.
Many children who are typically in the age range of 5 to 12 express no interest in having friends or being sociable, but their parents feel extremely pressured and feel like they should enroll them in social skills groups or try and arrange play dates. What are your thoughts about that?
I had friends who shared interests, building art projects together, building a tree house together, flying kites together. Get the child involved in shared interests, because that's where I'm going to get friends. They like computers, do computer stuff together. They like art, do art projects together. Get them into different school clubs, band, computers, chess, history club, historical reenactment things. It's through shared interests. Science fiction club, whatever the things that they're interested in. That's where I have friends.
What do you do if there's a child, let's say, who's approximately 10 years old and who tends to perseverate on one topic, for example, the solar system? Is this something that should be discouraged, and how do we go about
Okay, let's say you have this kid and all he wants to do is talk about the solar system. Let's broaden it out. Let's start learning about how the planets circle. How does the gravitational field of the sun affect it? Start using that motivation to teach science. Okay, the solar system, well, let's talk about solar power. In other words, make a link. Use that interest in the solar system to trigger an interest in science in a more general way. What you want to do is make an associative link back to the solar system. Earth is part of the solar system. Let's start studying how the sun affects the Earth, and you broaden it out.
Sometimes we children on the autism spectrum are frustrated or angry, or for no apparent reason at all, they tend to become aggressive towards their siblings. And how do you think parents should handle this?
Well, you have to look at what is causing a behavior. First thing you've got to do is it behavioral or is it biology? And your two main biological reasons for a problem behavior are sensory overload, like flickering fluorescent lights, or sound sensitivity, or maybe they're afraid to go into that room because last week the smoke alarm went off in there, or maybe they have a hidden painful medical problem, yeast infections. Another common problem is acid reflux and all kinds of gastrointestinal problems. You'd have to get that cleared up. Urinary tract infections, toothaches. I tried tapping his teeth to make sure he doesn't have a sore tooth. You've got to rule out hidden painful medical problems and sensory issues first. Then you can say, yes, the problem is behavior. But the first thing you've got to do is separate biology from behavior.
And if they find it's a behavior problem?
Then you got to figure out, is it frustration because they can't communicate? Is it getting out of doing a task? Or getting attention? It's like three basic motivations. Frustration without not being able to communicate, get out of doing something, or to get attention. You have to figure out what is causing the behavior. And you also want to make sure you don't accidentally reward bad behavior. There was a problem in one class where this kid was biting the teacher and kicking, and they take him out and pick flowers. Well, now you've just rewarded bad behavior. You don't want to, you can sometimes accidentally do that.
What's the best way to determine a child's learning style if they're nonverbal?
Well, you have to look at what is a child good at. And I'd strongly recommend a book called How Can I Talk If My Lips Don't Move by Tito Mukapadahe. If you're working with older children and adults that are nonverbal. Okay, now you have kids higher up on the spectrum. You've got to figure out if they're a visual thinker like me, who thinks in photorealistic pictures. The HBO movie did a fantastic job of showing how I think in pictures. Those kids tend to have a problem with algebra. I had a terrible time with algebra. Another kind of thinking is the pattern thinker, sort of a more abstract kind of thinking. Oftentimes these kids have trouble with reading. And then there's another kind of thinker that's a verbal thinker. These are the kids that often love history. And they definitely are not a visual thinker, and they do not have drawing skills. And on the higher end of the spectrum, you can kind of figure out what kind of thinker a kid is around 3rd or 4th grade, 8 or 9 years old. And then some kids that are nonverbal are going to be an auditory thinker because the visual system is scrambled up and not working right. So they're going to, hearing will oftentimes be their best sense.
It seems like more and more kids are being medicated these days. What are your thoughts about that?
I am very concerned about too many heavy-duty medications being given out to little kids like candy. I think a much better approach with little kids, I'm talking about 5-year-olds, 3-year-olds, let's try some of the special diets first, like wheat-free, dairy-free, lowering the amount of carbs, try some fish oil supplements. I mean, I think it's really wrong to be giving out powerful drugs to little kids is absolutely the first thing that you do. But on the other hand, there's a place for conservative use of medication, older children and adults. You try a medication, you want to go, did it actually work? And for a medication to be worth the risk, there should be some wow factor, like, wow, this really works. For anxiety problems, sometimes a little tiny dose of Prozac works. Sometimes only a quarter or 1/2 the starter dose. The mistake that's made with drugs like Prozac is giving too high a dose. Take too high a dose, people on the spectrum, you're going to get agitation and insomnia. And too oftentimes doctors are raising a dose when they need to be lowering. Prozac's actually a really, really good drug, and but you got to use it in just small amounts for people on the spectrum. And it especially works for anxiety.
People on the spectrum are constantly being corrected and told to behave differently. And how do we do this and not destroy their self-esteem?
I got self-esteem through getting recognition for things I was good at, like doing drawing. It made me really happy when I designed a cattle handling facility and a rancher built it, and then I got, praised and paid for building it. I got self-esteem through getting recognized for good work that I did, using my area of skill, which was visual thinking.
A common concern seems to be that children do things like they constantly replay a video in their head, or they keep repeating certain phrases. How do we tackle that?
Well, I did that. When I was a little kid, I was called tape recorder for saying the same thing over again and talking about my favorite subjects over and over and over again. After I went on antidepressants in my early 30s, I got less that way. In fact, the movies showed me in the 60s and the 70s, before I took antidepressant medication, you have to have some rules. Don't talk about the same subject more than twice to the same person. And cutting the anxiety down, that helps to reduce some of that separation. You also need the direct fixations into skills that other people want and appreciate. In the HBO movie, I built the gate that could be opened up in the car. I actually built that gate. It was shown exactly the way it was shown in the movie. Well, that was something that my aunt appreciated that.
Sometimes children's skills are really obvious, such as music or drawing or on the computers. But what about if their talents are not as clear? What can parents do to sort of help them?
Well, sometimes it isn't really clear what the person is good at. Usually, if a kid's going to be good at drawing, by 3rd or 4th grade, 8 or 9 years old, you'll see the drawing skill. You cannot tell in 3 and 4-year-olds, usually. Kids usually have to be a little bit older before you can start to see where the skills are. But what does the person like to do? We need to be thinking more and more, what is this person going to do when he grows up? We're not doing enough thinking about that. And another thing that concerns me is I'm seeing too many people getting fixated on autism rather than getting fixated on some favorite thing, like astronomy, or in my case it was cattle chutes. Because that fixation on cattle chutes That was the drive that made me start my career. And if I'd been fixated on autism, I wouldn't have done my career.
Reading comprehension is fairly easy when it just comes to the facts. But what about when it gets more abstract and you can't use visuals? What do you suggest we do there?
Well, there's a problem with understanding more abstract concepts. Like, for example, let's say you read a story that they had waffles and maple syrup on, for a meal, and the question was that what meal was it, breakfast, lunch, or dinner? That's kind of a bit more abstract than just saying, well, what was the name of the two people, Jim and Sally, for example. Well, one of the ways to teach that is by many specific examples. Autistic thinking is bottom-up thinking. Every concept is learned by specific examples. How do you teach a concept like not running across the street? You've got to teach it in many different places. How do we teach number concepts? If we just teach number concepts with counting pennies, then the child might think it just applies to pennies. You've got to teach it with pieces of candy, toy dinosaurs, pencils, paper clips. Then they'll start to understand that number concepts apply to many, many different things. You've got to teach proportion, less and more. Okay, I got half a bottle of water, or I got a full bottle of water. I got a half an apple, or a whole apple. You teach it with many different things.
And so basically they'll have a way to categorize that information.
Well, you just have to explain it. I think you just have to take a whole lot of stories and just explain it. Well, they had waffles. Waffles are breakfast food. And you just explain enough of these specific examples, they'll build up a database of specific examples. And then they'll read another story where it's enough similar that they'll be able to figure it out. They'll start to get the pattern. But that's how everything has to be learned in specific example. Bottom-up thinking. Normal brain is top-down. The normal people tend to overgeneralize. Like when I ask people about behavior problems, they say, my kid has behavior issues in the classroom. I don't know what behavior issues in the classroom are. Is he hitting people? Is he laughing? Is he rude? What exactly is he doing?
Parents are very concerned about siblings and the family unit. They want to keep the family unit together on outings, but they don't want their siblings to lose out on events that children with autism can't handle. So
well, I think that for the siblings need to get some quality time. Mother addresses that in her book, and I think there's some situations, especially with a child with severe autism, where the siblings and the parents need to do some events just on their own and have a sitter or somebody take care of the child with autism. And then other events you want to try to do together. Hopefully, maybe some dinner outings or church or synagogue. Hopefully, some of that can be done together.
Parents never know if they should reveal their diagnosis to the child because they're often afraid that their children will use it as a crutch. So do you suggest that parents tell their children?
I think some of the best things we're going to do is read some of the books by people on the spectrum. Now, of course, none of those books existed when I was a child. But it would have helped me to read some books, people on the spectrum. But I'm also getting concerned about kind of a handicap mentality, where sometimes the kids are not pushed enough. Like the kid's lazy and, he's 13 years old. I think he maybe needs to walk some dogs or have a paper route. When I was 13 years old, I had a little sewing job. When I was 15, I took care of 9 horses. I'm learning his work skills. The thing is, you got to push something. If you don't push it all, then there's not going to be any advancement. If you push too hard, then there's going to be temper tantrums and problems. You kind of always got to keep pushing the envelope a little bit, or they're not going to advance. My mother was, she had really good instincts. I didn't want to go to the ranch originally. My aunt's ranch, I was afraid to go. She gave me a choice, 2 weeks or all summer. But on the other hand, I had lots of information about the ranch before I went. No surprises. Surprises scare. I had pictures of the ranch. I talked to Ann on the phone. So it wasn't a total surprise.
When you were in high school and by the time you got to college, you had already endured so much taunting and bullying from other kids. How did you manage to keep your chin up and move forward and just not let your self-esteem get destroyed?
Well, the only way I managed to survive all the teasing, and it was horrible, is there was some refuges away from teasing. Horseback riding, electronics lab, model rocket club. Those were places where there was no teasing. And I had friends and peers in those activities. That's why we've got to get these kids into these activities where you can do shared interests.
What do you think are your main qualities that have made you so successful today?
Well, you've got to have perseverance. I can remember when I had some problems at one of the meat packing plants, the plant superintendent said to me, you've got to keep persevering. I remember seeing some scribbled graffiti that was on the wall of the art building on the Arizona State University campus that said, obstacles are those terrible things you see when you take your eyes off the goal. Those kind of little things stuck with me. The other thing I had to learn is to sell my work, not myself. And I remember going to an agricultural engineering meeting in the early 70s. They didn't want to talk to me because I was too weird. And then I took out those drawings that I showed in my talk of the dip fat. And they go, oh, wow, you drew that? And I have to say one thing that really turned me on in the HBO movie is my actual drawings were in that scene with the conference room with all the people standing around it.
A child who's 5 to 10 years old, what can parents do to really prepare them for the world?
Well, you got to take, kids 5, 10 years old and expose them to a lot of different things. I was taken out to a lot of different places. By the time I was 6 or 7 years old, we could go to a nice restaurant, and that'd be a quiet one. We could go to a nice restaurant, and I behaved. I liked eating at a nice restaurant, so I behaved. And again, you've got to differentiate between biology. We went to a really noisy restaurant with a super loud band. I would not have been able to tolerate that. I was expected to behave in church. Fortunately, the church didn't have any sensory overload problems. You know, I had an old-fashioned organ, and I actually liked the organ. Hated the clothes I had to wear because the scratchy petticoats kind of itched. There has to be some expectations for behavior. You know, you got to push them hard. You got to push them enough to make them advance, but you don't push them so hard that you're going to have temper tantrums and you're going to have a problem. You know, a good teacher is kind of gently insistent, always kind of pushing the boundaries of the envelope to try to get you to do new things.
I've heard you mention manners and behavior a lot. Can you just tell me what your thoughts are on that?
Oh, there were some expectations for manners. I mean, if I did something like comb my hair with my fork, I mean, Mother said, get that out of your hair, that's bad manners, don't chew with your mouth open. You cannot eat mashed potatoes with your hands. You know, manners were just taught one specific example at a time. You know, I couldn't, eat meat with my hands. You know, you had to cut it with a knife and fork.
Do you think that people today are, on the autism spectrum, are getting away with more?
I'm saying too many absolutely atrocious table manners. Way too much of that. And there's a scene in the movie where my boss slammed down the can of deodorant. He said, you stink, use it. That actually happened. In fact, I showed Mick Jackson, the director, exactly how to slam it down. That was done exactly like how the boss actually did it. And I was very furious at the time. But I look back and I thank the boss for doing that. I'm seeing too many guys coming in, they're all full of stubble. So they'll either shave or grow a beard. But you know, it's fine to be eccentric. I think the eccentric's okay. The eccentric's okay. But being a total rude, filthy, dirty slob's not okay.
And what do you think about the focus of finding a cure for autism rather than just concentrating on treatment?
If you got rid of all of the autism genetics, you get rid of the next generation of Silicon Valley. You get rid of the next generation, you would solve the energy crisis. You say a little bit of the autism trait gives you some intellect, but you tend to not be very social. Too much of the autism trait, and you get a lot more problems. It's a complicated genetics. You're not going to, it isn't something simple, where it's a simple genetics you can easily get rid of. But if you totally got rid of it, let's say you got rid of it a long time ago, we wouldn't even be here today working with a video camera, because who do you think made a video camera? It was all the kind of people with some Asperger's genetics that did that.
So is there anything else that you'd like to add?
I just want to think I'll talk a little bit about diagnosis. Diagnosis is not precise. It's a behavioral profile. It's not precise like tuberculosis or, some disease where they can tell you exactly what, disease you have. Asperger's is not a separate disorder from autism. It's all part of the same continuum. Then you get PDD. What is that? People get too hung up on these labels. I find the normal human mind gets hung up on the labels. They say, well, my kid's autistic. What do I do? Well, I'm saying, okay, what is his problem? Okay, does he have a problem not have friends? Is he having temper tantrums at school? What exactly is the problem? I'm going to solve the problems. These diagnostic labels are not precise. I'm trained as an animal scientist, as a hardcore biologist, and behavioral profiling is not, to me, very scientific. I can't wait until in the future they can get high-speed brain scanning and they start to figure out exactly where some of the problems are, and then you can direct therapies. Okay, this child has a problem with touch sensitivity, or this child's going to have a problem with 60-cycle fluorescent lights. Let's do interventions to help the malfunctioning visual system.
I know that you have a new DVD coming out. Can you tell me about that?
Yeah, the DVD of the HBO movie will be coming out August 17th. Use keyword Temple Grandin to search for it.
Okay. Well, this interview has been enormously helpful. Thank you very much for taking the time to be with us
Thank
today.
you very, very much.